We hold a very significant level of responsibility for healthcare in the state of New Jersey, and that's something that we embrace. We don't walk away from that, we run toward that. The Blue Cross and Blue Shield brand is among the strongest in the world, and I can assure you it's among the strongest in the state of New Jersey. Horizon took a hard look at and listened very closely to our members and our customers. And what they told us was that they were not able to keep up with the increases in the cost of healthcare. There seemed to be no accountability for the quality of care that was being provided. So we challenged ourselves to say, if we could start from scratch, how would we change this? And what we figured out was that we needed to hold ourselves accountable not only for what a health insurance company would traditionally do, but rather for how care was actually delivered. We believed that the first step in that process was to change the incentives for providers. This is where our value-based care strategy comes into play. We've actually built a set of products around value-based care. We've called them Omnia, at rates that are approximately 15% below essentially a non-value-based chassis. And between having a more affordable premium level and a lower level of out-of-pocket expense, we have made care more affordable in the state of New Jersey. We did an analysis, literally block by block, to determine what are some of the needs and what are some of the characteristics of our members that lived in traditionally underserved areas of the city of Newark. What we learned most importantly was that they were not accessing the healthcare delivery system. And secondly, their total cost of care was approaching 10 times the expense of our average member across the state of New Jersey. So we partnered with a healthcare delivery system based in New Jersey, Robert Wood Johnson Barnabas Health System, who's very committed also to the city of Newark. By getting them connected with primary care physicians in those blocks in which they live, we've been able to improve the quality, significantly reduce unnecessary utilization, and frankly, improve their health status along the way. I'm very excited about where we are in healthcare in the United States today. I know that there are many challenges, but we're at a point that's unique in the history of healthcare in the United States today. We finally have the tools in place in combination with the mindset of consumers and the technology to actually serve the needs of our members much more effectively than we've been able to in the past.